So in today's topic, we'll be looking at dizziness and vertigo. So what is dizziness? A layman, anybody would know the definition of dizziness is when you generally feel like you're losing balance. So a general feeling of unsteadiness, lightheadedness, or feeling like fainting. So it can be caused by many different health conditions, ranging from blood pressure problems to inner ear disorders. And vertigo is like a specific type of dizziness. So it's the false sensation that the person or their surroundings are spinning or moving, typically due to disturbances in the vestibular system of the inner ear. So dizziness is among the most frequent complaints in adult patients, particularly in the elderly populations. And vertigo accounts for a significant portion of dizziness, the dizziness cases, and it is typically related to the vestibular dysfunction. So identifying whether the dizziness is due to peripheral, that is ear related, or central, that is brain related causes is critical for like the effective treatment. So what exactly causes both dizziness and vertigo? So dizziness has a lot of causes. Number one, it could be due to a sudden drop in blood pressure when standing up. So in this case, it is known as orthostatic hypotension. Then we also have irregular heartbeats could cause dizziness, like arrhythmias. Then also having low blood sugar, hypoglycemia, having low blood levels in cases of anemia, and then excessive fluid loss, like when you are dehydrated, it can cause you to have these symptoms of dizziness. And then anxiety, panic attacks, and then it could be side effects of some medications like sedatives, antihypertensives, antidepressants. So these are all the random things that can cause that can lead to dizziness. Then when it comes to vertigo, that is usually caused by imbalance in the inner ear. So we have different kinds of vertigo or different causes of vertigo. So there is something called benign paroxysmal positional vertigo, BPPV, and it's caused by calcium crystals, which are known as otoliths. So these otoliths are small crystals of calcium carbonate found in the inner ear that usually help with balance. So it is caused when these otoliths are dislodged into the semicircular canals. Then we have vestibular neuritis, which is another cause of vertigo. And here, this is like the inflammation of the vestibular nerve, which is usually caused by a viral infection. And there's another disease known as Meniere's disease, and this is basically like having excess fluid in the inner ear. So this could be another cause of vertigo. Then labyrinth too, inflammation of the labyrinth, and the labyrinth is basically a complex system of fluid filled tubes in the inner ear that are involved in hearing and balance. So when there's an inflammation of this labyrinth, it can cause vertigo. And also inflammation of both the vestibular and the cochlear nerves. Then there's also migraine associated vertigo. So in the previous video we treated migraine. So vertigo can come alongside the symptoms of migraines. So there will be dizziness or there will be vertigo, which can occur with or without like the migraine headache. Then we also have some tumors affecting the balance nerve, like acoustic neuroma. So this could also cause the symptoms of vertigo too. So signs and symptoms of both dizziness and vertigo. So with dizziness, there will be a sensation of lightheadedness or feeling like you are floating, or blurred vision, feeling like you want to faint, feeling weak, unsteadiness, sweating, palpitations. Then for vertigo, there will be a spinning sensation, like the room is spinning. There will be loss of balance, difficulty walking straight, involuntary eye movements known as nystagmus. Then it can also be associated with nausea and vomiting. And then tinnitus, that is ringing in the ears, which is usually a symptom that is seen in Meniere's disease, where there's excess fluid in the inner ear. So looking at the anatomy of the vestibular system, the vestibular system is basically located in the inner ear, and it includes the semicircular canals, the auricle, and the sacral. So these structures, they detect changes in the head position and the head motion. So signals are sent through the vestibular nerve to the brain stem and cerebellum, which then coordinates the balance and visual inputs and signals from muscles and joints. So in cases of looking at the pathophysiology of these different disorders that lead to vertigo, like when we have benign paroxysmal positional vertigo, so here the otoliths, that is the small calcium crystals, balanced calcium crystals from the auricle, they dislodge and move into the semicircular canals, disrupting the normal fluid movement and causing inappropriate activation of balance signals. Then in cases of vestibular neuritis, so a viral infection will cause the inflammation and the dysfunction of the vestibular nerve, leading to acute vertigo. Then in Meniere's disease, I think that's how they pronounce it, there will be excessive accumulation of fluid in the endolymphatic space, which causes distension and pressure in the inner ear, leading to episodic vertigo, ringing in the ears, and sometimes hearing loss. Then we have the labyrinthitis, which is the inflammation of the labyrinth. So inflammation of the labyrinth causes both vertigo and hearing loss due to the involvement of both balance and auditory components. So the involvement of this labyrinth in both balance and the auditory nerve. So looking at the differential diagnosis, other conditions that could mimic the conditions where we see the signs of vertigo. So like I said, benign paroxysmal positional vertigo, vestibular neuritis, labyrinthitis, Meniere's disease, migraine associated vertigo, then transient ischemic attack or stroke, especially with risk factors like hypertension or diabetes. They often include slurred speech, weakness, or loss of coordination. Then tumors such as vestibular schwannoma. So there will be gradual onset vertigo and hearing loss, anxiety or panic disorder, low blood sugar. So when these conditions arrive, they usually come with signs of vertigo. So looking at the diagnosis of both dizziness and vertigo, detailed history. So we ask about the nature, the onset, the duration, the triggers, and the other associated symptoms. Then physical examination too. So focus on the person's balance, their eye movements. Then there's something that they use to diagnose benign paroxysmal positional vertigo, and this is known as Dix-Hall-Pike maneuver. So this is particularly used for the diagnosis of this vertigo. Then also carrying out neurological exams to rule out stroke or other CNS causes of the dizziness. Then audiometry is done too, which is a hearing test in patients with tinnitus or hearing loss. Then MRIs or CT scans can be done if a central cause is suspected, like if the cause of the dizziness is involving the CNS rather than coming from the inner ear, like you see in vertigo. Then blood tests too, so check for anemia. If the person's blood level is low, check for anemia, check for blood sugar, electrolytes, and also like thyroid function too, because all these things could also be a contributing factor. So looking at the treatment of vertigo. So when it comes to benign paroxysmal positional vertigo, BPPV, so there's something called Canalith repositioning maneuvers, and an example is airplay maneuver, and is used to move the dislodged calcium particles, that's the otoliths, back to their original location in the auricle, which would restore the balance in the inner ear. Then for we also have vestibular rehabilitation therapy, which includes balance training and some various head exercises. Then some medications for symptom relief, like for example betahistine, 60 milligrams, which can be taken 3 times a day orally. Then alternatively, we could also use meclizine, 25 to 50 milligrams, which is also taken orally for every 6 to 12 hours. Then these medications, they should only be used for a few days, as they can delay like the compensation, like they can delay the time the body, like they can delay the body from getting back to its original balance, like the compensation mechanism of the body. So they should be used for a short period. Then in cases of vestibular neuritis that is caused by viral infection or inflammation of the labyrinth that we see in labyrinthitis, so bed rest and hydration should be encouraged during the acute phase. Then we can use corticosteroids like prednisolone for up to like 7 days. Then antiviral medication such as acyclovir if when we have vestibular neuritis. Then some symptomatic medications that we could give, so for the nausea, we could give promethazine 25 milligrams orally every 6 hours, and we could give diazepam 2 to 5 milligrams orally to help with the vertigo. So we should give these medications for a short duration in order to avoid suppression of the central compensation, like I talked about. Then for Meniere's disease, when it comes to Meniere's disease, so we have to encourage dietary changes like low salt diets, aiming at less than 1.5 grams per day, avoiding caffeine, alcohol. Then we can give diuretics, because in this Meniere's disease it has to do with excess fluid, and diuretics are known to be good medications for draining excess fluid. So we can give diuretics like hydrochlorothiazide, thiamptrine. We can give this combination daily. Then we can give vestibular suppressants like betahistine, and some surgical options could be considered, to like endolymphatic sac decompression in resistant cases. Then looking at migraine associated vertigo, when we have vertigo that is associated with migraine, so lifestyle modifications like avoiding the known migraine triggers, such as if it's stress, if it's when you eat a certain type of food, like maybe chocolate. So avoiding these triggers is number one in the management and the treatment. Then some using like prophylactic medications like propranolol or amitriptyline. Then we can use for acute treatment, we can use the triptans like somatriptan. We can use it at like the onset of the migraine symptoms. So for general management of dizziness now, we've looked at vertigo. So when we are looking at general management of dizziness, so we address the underlying cause. So if the person is always getting dizzy because they have low blood pressure, so we address this condition. If it's due to low blood sugar, we address it. We encourage them to try to be taking more of how do I put it, we try to encourage them to look at their diet, what they are eating, maybe taking more carbohydrates, so to increase their blood sugar levels. Then if it's due to medication side effects, so maybe switching to an alternative medication or reducing the dose. Then also we have to promote hydration and adequate nutrition. Then because sometimes you can be dizzy because you've not eaten. So dizziness has a lot of causes. Because me personally, when I've not eaten in the morning, I get this banging headache. And if our dizziness can come if I've not eaten, like if it's like 12 p.m. and I've not eaten, I can start getting dizzy. I can have this tension type headaches. So try to stay hydrated, because water too helps. Try to stay hydrated. Try to eat the regular amount of food that you deserve to eat. So if you've not had breakfast and you are dizzy, I don't know what you are looking for, because the answer is very obvious. Then we also have to advise patient education, like educate patients on what can cause their symptoms of dizziness and what they should do in this case. So looking at the prevention, so for benign paroxysmal positional vertigo, we have to avoid sudden head movements and sleep with our head elevated. Then maintain good hydration, reduce salt intake and caffeine in patients with Meniere's disease. Manage migraines with regular sleep, having a balanced diet, reducing stress. So and also use vestibular rehabilitation exercises in patients with chronic vertigo, and avoid alcohol and smoking. So that is basically it about this topic, dizziness and vertigo, and I hope you enjoyed this video. So I'll see you in the next video. Bye.